is Great Look Monday, and we have Dr. Sam Shatkin back with what we like to call liquid rejuvenation. It's kind of like a liquid facelift, but liquid fillers that are used for face and hand rejuvenation. And Dr. Shatkin is here with Kathy Ackerman, his assistant, who's going to be, I don't want to say our guinea pig today, but she's going to show you this. Sport. And this is really incredible. So it's nice to have you both back.
Good to be back, Linda.
And as you say, this can be used in the face, but this can also be used in the hands.
Well, you know what's interesting? The patients that come to our office come because they want to look young again. They want to look like their daughter. So this morning we did Kathy's injection. Now, many of you may know that her daughter actually works at the office too. She's one of our cosmetologists. So I had Kathy and Chelsea put their hands next together this morning after Kathy had one hand treated. And I'd like to show you that picture right now because everybody wants to look like their daughter.
And that's really indistinguishable. So whose is whose?
Yeah, well, I know which one because Kathy's got the French manicure on her.
Okay, if she opens it up, yeah.
So this one is Kathy, and this is Chelsea. Now the contour and the softness of the hands look very comparable.
They do.
Okay, now I'm going to show you a picture of the opposite hands, the ones that were not treated. If you can zoom in on that, okay? Again, this one's Kathy, who's the mother. We won't say how old here. And then this is Chelsea. So you can see the hands definitely look different.
Yes.
Okay, so what we want to do today is show you how easy it is to do this treatment.
Okay.
And I'd like to do that on her non-treated hand. We did the one hand. Put your hands here, Kathy. And I don't know if they can, tilt them this way so they can see.
Yeah.
This is the hand that we treated.
That you can definitely see.
And this is the hand that we have not treated yet. And I'm going to show you how easy it is to do this treatment.
And there are some people who, just by genetics, have a hand that looks like it ages maybe more than other people, you know?
But like I said before, everybody wants to look young.
Oh, yeah.
So put your hand down, just the one hand there, Kathy. You can put that one aside. Okay, so this is how we're going to do it. So first, it's really fairly easy, and it just takes a few minutes.
And you've already had a little bit of a numbing agent applied.
No numbing.
No? Really?
No numbing.
No numbing?
I mix the numbing. I'm going to show you how I do it in just a second.
Oh, okay. I assume that you get a little
just clean it with
relief
alcohol.
From this, but
all right. Yeah, don't try this at home.
Don't try this at home.
I just clean the hand with alcohol, and here's the syringe, and I'm going to actually physically mix the two. I don't know if you can see.
This is like the doctors.
Mixing.
This is great.
Well, this is right. They did present this on the doctors.
Yeah.
And, as you know, Linda, we're the sponsor for the doctor's show, and we mix the solution.
So you're mixing the numbing cream with the filler.
Just so you know, I've been doing hand rejuvenation for many years. Most of the time we've been doing fat injections, but the nice thing about this is it doesn't require any surgery. I basically open up the box, put the needle tip on after we've mixed it, and if you're a little squeamish about watching needles, then don't watch this part of it. And then Kathy's going to make a fist, and I'm going to just physically inject it right in. I don't know, can you see that on the screen?
So you're injecting the filler and the numbing. So how does it feel, Kath?
It's really not bad? She feels hardly anything.
No. And look.
That's easy for me to say.
It's plumping up. It's plumping up right in front. Look at that.
But I'm going to show you what we do in just a minute. It's a really neat technique, and like I said, I've been doing injections for years, but this makes it so easy. This is Radius.
Radius,
it's a calcium hydroxyapatite material, and we inject it. We have to be careful about the
veins,
and all that stuff, but we're trying to soften the tendons. You're going to see right in front of you how this transforms her skin. And
it's basically one syringe full.
Yeah, now she's not flinching at all because you're looking at her hand now, you're not looking at her face.
And there's no bleeding either.
Well, there's no bleeding.
Well, there's nothing.
Little needle marks. No. All right, now what she's going to do is turn your hand this way. Now see, it's very lumpy.
Right, you can see where it's been injected.
All I do is massage that and smooth it right out into the tissues. There's another lump there. See the big lump there? Now watch what happens. I just massage it a little bit and soften it. And all of a sudden, now she's got a hand that's starting to rejuvenate.
Wow.
And it's really that easy. And I'm going to do a little bit more. Holding it up there probably be better for the viewers.
How long would this last before it starts to just dissipate?
The injections, when I do the fat injection, they last well more than a year. With this, they're probably going to be close to 18 months even.
Wow.
So this is really, now see, this is almost completely done. I can do a little bit more, but I don't want to take too much time because we have other things to discuss, but that's how easy it is.
That's amazing.
See, and then this is one that had a full treatment, but I've got a little bit more massage on there and some other things to do for her, Kathy. But we've been using this Radius material for several months, and we like it. We use it for facial rejuvenation.
We can
use it for a non-surgical rhinoplasty to correct the hump on the nose.
Wow.
And other things too. I guess we'll finish this up, Kathy.
That's amazing. And Kathy, you've been happy with it?
Yes.
That's great.
Well, we did so. Now we can show the photos of Kathy's face, because we did we did her live on there for her
Kathy's
facial
a good
injections.
sport, everybody. She's a real good sport. Okay, now
So this is Kathy before and this is Kathy after the injections, and we've repeated it since then because these pictures were done over a year ago. You can see the softening we did were around the mouth. And the logo there sort of hides. There you go.
There we go.
Around the mouth, underneath the eyes, where she had those deeper troughs.
Yeah, that's amazing that we can do under the eyes now.
Yeah, I mean, it really makes it very rejuvenated.
That looks
and
terrific.
now let's look at her hand, and let's go back to the live.
Okay.
See, there's her hand now. Okay, and it looks a lot like her other hand. And it looks a lot like her daughter's hand, who's several years younger.
Wow.
We won't say exactly how much.
That's terrific. And again, and it's as quick as that. It can be as quick as that.
It's faster than that because I took some time and we were explaining things. But
right, that's
it's an
amazing.
easy procedure. So if you're bothered by the hands, you know, so often we're focusing on what the face looks like, and that's good because that's what people see first. But the hands can be a telltale.
Right, right.
So why not try to do something to rejuvenate them?
Well, there you go, everybody, and it's as fast as that. We're out of time already, so that was amazing. If you want to know more, the Aesthetic Associates, this is where you're going to get this kind of treatment, and this is where you're going to find this information. Dr. Sam Shatkin, his brother Todd, there's Dr. Sam Sr., all at the Aesthetic Associates with Kathy and the great staff there as well, and they're at 2500 Kensington Avenue at Amherst. Give them a call at 839-1700.
And the Valentine's Day special.
Yes?
We have some specials with Valentine's Day and $100 discount on the injections that we just showed you.
Wow, fabulous. So there you go, everybody. There's no reason not to call and ask about this. And if hands were always something that you shied away from, maybe not. Maybe this is your answer. Again, at the Aesthetic Associates, they can help you. 2500 Kensington Avenue in Amherst. The number, once again, is 839-1700.